Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we can't see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you, Rachel. Good morning, everybody. Glad you could join us. Hope everybody had a good 4th of July. And let's go ahead and get started because we have got a lot to talk about today. First, wanted to remind everybody that the Medicare Assistance Program is a grant-funded program that is brought to you by several grants from the Administration for Community Living that give us funding to go out and educate people about Medicare. What is Medicare? How does it work? How do you keep yourself from becoming a victim of Medicare fraud? What do you do if you find yourself short of funds and you need some assistance paying for your prescriptions, et cetera, et cetera. So if you've got any questions about Medicare, or concerns about Medicare fraud or anything like that, please don't hesitate to reach out to us. And we have our contact information available at the end of this presentation. Today, we are talking about preventive services, or as I like to say, do you want to stay well versus get well soon? Preventive services is something that was not always covered by Medicare. In the beginning, Medicare pretty much just covered you when you got sick. But finally, somebody got wise and realized, you know what? This is something we should really be looking at, keeping people healthy. So finally, they started covering these preventive services. So what are they? This is care that you get to keep you from getting sick. This is aimed at preventing illness and detecting any medical conditions that could maybe be simmering in there. They haven't quite started yet, but they're there, the beginning signs of those. And they're at a point where we can maybe stop them from getting any bigger. So the idea is let's keep people healthy. What a concept. So they include different screenings, vaccines, counseling on things that you can do, activities that you can do, or actions you can take, diet, things like that, to keep those things from happening or keep your body healthy enough that it can fight off illnesses. So it applies to both Medicare as well as Medicare Advantage plans. So it doesn't matter how you're getting your Medicare, those are going to be covered services. Now, how they're covered might be a little bit different. So we're going to go over some of that as we go through this presentation. Now, why are these preventive services important? You know, early detection is very, very important when you're talking about different medical conditions. Folks, I promise you, I've never, ever, ever been in a conversation with anybody when they were talking about somebody who got sick and somebody said, oh, gosh, but did you hear they caught it early? What a shame. No, it never goes that way. All right. They always say that whenever they caught it too late. All right. Early detection is so critical. When they catch these things in their very earliest stages, that's when it's the most treatable. That's when they can do the most good in treating these things. So it's really, really, really a great idea to take advantage of these preventive services when they can find those conditions or when they can find those precursors, those identifying markers that tell you when something might possibly be about to appear in those earliest stages. It also improves those health outcomes. Oftentimes, let's face it, folks, we're not getting any younger. And whenever we go through one of those really serious conditions, those illnesses and stuff, our bodies just don't bounce back like they used to when we were younger. So if we can identify those conditions early and go through the fixing the condition earlier, our bodies just respond better, and we don't have to go through that process of trying to recuperate. Our bodies, just like I said, we don't bounce back like we used to. Let's get it fixed earlier. Also, the potential cost savings. Treatment of most conditions in their earliest stages is much more cost effective. It's cheaper to treat something in its earliest stages versus whenever it has actually been there for a while, it's had a chance to spread. It can impact more organs or more parts of the body. It's also had a chance to actually tear down your body somewhat. So there's probably more things that need to be fixed or worked on, or your body needs to be built back up. So the cost savings of early detection are much, much greater. Now, the cost for preventive service is another great thing because most of the preventive services that are covered at 100%. And that makes a lot of sense too. Think about it. Medicare covers most of our stuff at 80%. If they're covering you when you're sick at 80%, but they could cover a preventive service at 100%. Doesn't that make sense? If we can prevent you from getting sick and pay for that at 100% versus waiting until you get sick and we have to pay for a long time for 80%, the cost difference is going to be significant. Trust me, that 80% is going to come out to be way more than if they just pay for the 100% of the preventive services. So yes, this makes a lot of sense from a cost savings perspective. So yeah, of course, Medicare is going to want to cover these preventive services at 100%. Now, it is important that you make sure that you are seeing a Medicare covered provider, that this is a Medicare participating provider that you are going to for these preventive services. Now, if you're on a Medicare Advantage plan, like I said, they also cover these preventive services, but make sure you're going to one of your network providers. If you're on a Medicare Advantage plan, one of the things that's important is that you are seeing those contracted providers that are part of your network. So be sure that you're going to one of those network providers if you want to get one of those preventive services covered. Now, under either one of those coverage types, it's going to be important that you make sure you meet the eligibility requirements for that preventive services. The preventive services doesn't mean you can just get a colonoscopy every year. Let's face it, folks, who wants to get a colonoscopy every year? But colonoscopies, mammography, bone mass tests and stuff, those things aren't covered necessarily every year for everybody. It's going to be based on your age. It's going to be based on your family history, your gender, other things like that sort of indicate how often a person should get one of these screenings. So you'll want to talk to your doctor to find out where you are on that scale and how often they recommend that you should get one of those screenings. So again, you'll need to talk to your doctor to find out which of the preventive services that you're eligible for and when you need to get those, and they can help you get those scheduled. So when might you be charged? You know, there are some times when a person might be getting a preventive service and all of a sudden something's going on, and now all of a sudden it's not necessarily a preventive service anymore. So let's talk about that. Let's say that you go in for a colonoscopy and it's a preventive colonoscopy. You've never had any problems whatsoever. You've never had a suspicious colonoscopy. You've never had any health conditions related to colonoscopies or anything like that. But you go in, you've done all the prep work. Trust me, people, it's not fun, but it is necessary. You go in for that colonoscopy, and lo and behold, the doctor finds a polyp while they're in there doing the colonoscopy. At that point in time, that colonoscopy is no longer a screening colonoscopy. It has now become a diagnostic colonoscopy because those polyps can be precancerous. They can indicate that something more serious is going on. And that doctor is going to need to remove that polyp and send it off to be tested. So now all of a sudden that colonoscopy is a diagnostic colonoscopy. It is still covered by Medicare, but it's going to be covered at 80%. All right. So it's very important that you did go in and get that colonoscopy because, wow, they found this polyp before it became something more serious and they were able to send it off and get it tested. Could have saved your life, even. The same thing would be true for a mammogram. Maybe you've never had any problems before, but you've gone in, you've gotten a mammogram, and they found a lump of some kind, and they got it checked out and stuff. It's still covered, but it may be only covered at 80% because now it's a diagnostic mammogram. They may even send you for something a little more in depth in terms of testing to make sure that everything is okay. So the important thing is that's what these preventive services are for. We want to keep you as healthy as possible for as long as possible. So, that's why we're encouraging people to take advantage of these preventive services in those earliest stages so that we can find that stuff. We want to catch it as early as possible and keep you healthy. Now, the other thing that we want to make sure that you're aware of is the test itself, the colonoscopy, the mammography, that bone mass index, all those tests are covered at 100%. Now, the doctor may charge you for a doctor's visit. Keep in mind, those doctors, they want to make sure that they're covering all the bases. You're coming in for a colonoscopy, but they've got, questions that they need to be asking you too about family history and other things that are important for their practice as well. So you may have a charge for an office visit or something like that, where the doctors had to spend their time and stuff in getting important information regarding you as well. So there may be a copay for a doctor's visit or something like that that's associated with it. And that's pretty common. The doctor's not trying to take advantage of you. That's just part of it. Now, another covered benefit is the Welcome to Medicare annual wellness visit. And that's going to be just a run-of-the-mill doctor's visit. You go in, check your height and your weight. They'll use that to get the body mass index, your blood pressure, vision. They'll do some general kind of medical and social history questions. They'll talk about like where you live, any mobility problems you might be having, what's kind of your social, like who your friends are, what kind of a support system do you have in terms of friends and family around and stuff like that. It's not going to be a full-blown physical where they're doing like blood work and x-rays and a lot of medical tests like that. This is just sort of an in general, how are you feeling? How are things going? Does anything hurt? Is there anything that concerns you? Are there any problems you're having that we need to discuss? Because the doctor is going to use this information to kind of establish, do we need to look at some of those other preventive service tests that need to be done, or are there any other more important tests that we need to be doing as well? So this is a very important benefit that we encourage people to take advantage of as well. Now, I will also throw in here at this particular time that there are some of us, myself included, that are train wrecks. I've already got a laundry list of medical issues. I'm not going to probably have an annual wellness visit because my doctor already knows about multiple medical issues that I currently have. And so I'm going to go in and see my doctor, and he's going to do some annual tests, blood work, x-rays, and things like that, because he knows of known medical conditions that I've got. And that's going to be more like an annual physical. It's going to be covered. It'll be covered at 80% because a wellness visit is not really required in my condition because he's already got that information on me. Now, also vaccines are very important as well. And some of those are going to be covered by your Medicare Part B, and others are going to be covered by your Medicare Part D, that drug coverage that we've got through Medicare. The ones that are covered by Part B, we're going to start with the flu shot. That's a very important vaccine that people need to be getting every year. A lot of times we think about the flu when we're younger and we're like, oh, what an annoyance. But flu can be very, very dangerous in the senior population. So the flu shot is covered one shot every flu season because as we know, it can get very different on us sometimes. And so that's going to be covered at 100% every season. The pneumonia shot is also covered by Medicare. Usually that's kind of a one-time vaccine that you have to get, but it is covered at 100%. Hepatitis B is also covered, and that's for people that have, that are at high or medium risk, people that have history, ESRD, hemophilia, who live with someone who has Hep B, that sort of thing. Now, vaccines that are also covered by Part B is going to also include the COVID-19 vaccine. Right now, thank goodness, it's at a low spot. Not hearing nearly as much about that, so that's good, but just good to know that that's where it is covered, is under Part B. Other vaccines that we probably don't hear as much about, but they're still out there for those of us who are rather accident prone. The tetanus shot, if you get stuck by a nail or something like that while you're out working in the garage, that is still covered by Part B. The rabies shot, that also, if you get bitten by some animal and you don't know whether they've had the rabies shot, that would be covered by your Part B as well. Now, other vaccinations that are covered are going to be covered by your Part D as in dog. The shingles vaccine, RSV, Tdap, those are all going to be covered by Part D. So it's going to be important that you make sure that you've got a Part D prescription drug plan or drug coverage under your Medicare Advantage plan if you could think you're going to need those vaccinations. Now, one of our founding fathers, Thomas Adams, is known for saying prevention is so much better than healing because it saves the labor of being sick. And I think that that's very, very, very true. Nobody really enjoys some of the things that we have to do and go through when we're talking about these preventive services. Yes, they're a pain. Uh, I won't go into the details on some of the things like colonoscopies and stuff. And, when it comes time for some of those doctor's appointments that you've got to go to, and you're like, I feel fine. I don't really want to do that. I'd rather go do this, or I don't want to get out in the heat or something like that. But when you think about it, folks, and, okay, even if it's not covered at 100%, but you just need to go and see your doctor. Have that relationship with a physician. Don't put medical appointments off, people. Uh, Stay healthy. Protect your health. It's so much more valuable than anything else. It's definitely worth more than sitting at home in the air conditioning watching television. Now, some of the most frequent used preventive services that are covered under Medicare, the cancer screenings like mammography, colonoscopy, pap tests, and pelvic exams, diabetes screenings, folks. As we get older, we're much more susceptible to diabetes. Bone mass measurements, folks, are very, very important. I had a great grandmother whose mind was as sound as a dollar her entire life. She could remember everybody's birthdays, all down to great great grandkids, everybody's anniversary, everything. But unfortunately, her bones had become so brittle she couldn't do anything but stay in bed, and that was such a tragedy. So, that bone mass measurement stuff is nothing to fool with, especially since we have medications now that can address that. Cardiovascular disease screenings. I've seen people who were healthy as a horse, we thought. Uh, this is that category where, never sick a day in their life really comes in, because you see these people who suddenly have a problem, and it can make a disastrous result if they didn't get tested. The annual wellness visit, folks, I can't tell you enough about how much of a change that can make in a person's life, how they can catch something that makes such a difference in a person's life and whether or not they have a life. So please get those things done. Where you can find out more information about this, go to Medicare.gov. Their website there on preventive screenings has got a little bit more information about this. The best place to find out more about this, talk to your doctor. Find out more information there. Also, if you've not done this yet, set up that Medicare.gov account on the Medicare.gov website. Folks, there's a lot of really good information on there. Information about your claims, information about your drug plan, information about the preventive services you may qualify for. News alerts, things that pop up on there can be very, very valuable. It's a great website. They're doing a really good job of keeping up with it. So I encourage you, if you've not set up a Medicare.gov account, now's a good time to do that. Also, like I said, discuss it with your doctor. Talk to them about those preventive services. There's a really good publication, and you don't even have to get the book anymore. You can literally just Google this book, Your Guide to Medicare Preventive Services, and it'll pull up the electronic copy on your phone, on your computer, on your tablet, and you can literally look through this book. It covers all the information about these preventive services, and it'll go through them one by one. So it's really, really, really a good publication. Now, one last thing I want to cover, because this is brand new, hot off the press. It just started July 1st. Medicare is not able, as a benefit, to cover GLP-1s, weight loss medications. So they came up with this short-term bridge program, and it's called the Medicare GLP-1 Bridge Short-Term Demonstration Program. It's going to run from July 1st, 2026 through December 31st of 2027. The goal is there's a great many of us Americans, and I count myself among them, who are overweight. And weight is tied to so many health conditions. If we could lose weight and live a healthier lifestyle, that would dramatically reduce so many of the issues that we're dealing with and make us healthier. So they are going to run this demonstration project to see if maybe that will have an impact on some of the health conditions that we're dealing with. So to qualify for this program, you do have to be enrolled in a Part D prescription drug plan. However, this particular medication will not run through your specific Part D plan. Okay, so you have to be in a Part D plan, but it's not going to go through your Part D plan. It'll be paid through a single payer that is contracted with CMS. That will have a $50 per month copay for the medication, and regardless of income, it doesn't matter if you're low income, high income, whatever, it's $50 a month. This amount does not apply to your out-of-pocket max. You know, there's the out-of-pocket max of $2,100 a year. It will not apply to that because this is not part of the Medicare system. You do have to be enrolled in a PDP. You have to be at least 18 years old at the time that you started taking that GLP-1. You have to have a body mass index greater than or equal to 35. Or you can have a body mass index of 30 with a diagnosis of uncontrolled hypertension, heart failure with preserved ejection fraction, or chronic kidney failure, stage 3 or above. Or you can have a body mass index of 27 with a diagnosis of prediabetes, history of heart attack, or history of stroke, or symptomatic peripheral artery disease. Now, the medications that are going to be covered under this program are Foundeo, which was a new one on me. I had not heard about that one, but I did see my first commercial over the weekend on this drug, only in the pill format. Wegovy in the injectable and the pill format. Zepbound as the quick pen format. Now, the process for applying to be part of this demonstration project. First, you talk to your doctor. Find out if you qualify for this demonstration project. The doctor is going to send a prescription to the pharmacy. If the pharmacy doesn't already have this, they're going to ask you for your Medicare number, or they can also do it using the last 4 digits of your Social Security number. Then the pharmacy will get in touch with the doctor. The doctor is going to have to complete a prior authorization form that's going to get Medicare's approval. They're going to get a prior authorization from Medicare for you to be covered under this. Once Medicare authorizes it, they're going to send a letter, Medicare is, to you confirming that you've been authorized to be part of this. You're going to take that letter with you and you're going to go to the pharmacy and you'll pay $50 copay and you'll receive your medication. And that's going to be based on whatever you've discussed with the doctor. If the doctor says this pill, this injectable, the quick pen, whatever. Now, once you've received that prior authorization, once you get that one letter from Medicare, that's good through December of 2027. You don't have to get another letter every month or anything like that. It's good for the entire project period. Now, there are some people who are already taking a GLP-1 through their Part D prescription drug plan. Some Part D plans are already covering GLP-1s for certain conditions, such as type 2 diabetes, obstructive sleep apnea, and metabolic dysfunction associated with blah, blah, blah. This has to do with fatty liver disease. Those are not eligible for this demonstration project. So if you're currently already receiving a GLP-1 through your Part D plan, you need to keep on it for those purposes. Don't try and switch and go over to this demonstration project. Stick with what you've got. Make sure you're on a Part D plan that covers your GLP-1 for type 2 diabetes, obstructive sleep apnea, etc. Okay? So, if you've got type 2 diabetes, sleep apnea, or this fatty liver disease, then make sure you're on a Part D plan that covers that GLP-1, because you would not qualify for the demonstration project. Okay, so this is brand new. This is just starting out. If you've got any questions about it, talk to your doctor. I had an appointment with my doctor last week. I asked him if he had heard about it. They've all heard about it. They're very familiar with it. So don't hesitate to give your doctor a call if it's something you're interested in. These are the agencies that we partner with around the state. If you live in one of these areas and you'd like to talk to one of our counselors, don't hesitate to give them a call. They would be happy to speak with you. Does anybody have any questions that I can answer at this time?
So it doesn't look like we have any questions that have come in. Just a reminder, everyone, that you can click on that chat button and you can go ahead and type any questions that you might have into that chat. And then you can always email us if you think about a question after the fact, and we'll be happy to help you out.
Also wanted to mention, we've been using our direct phone number recently, which is 405-521-6628. We've had a number of people that have been trying to call, and they got very frustrated because they said our 800 number wasn't working. And what we learned was that our 800 number is state specific. So if you've got an area code that is outside of Oklahoma, in other words, it's not 405-918-580 or one of the new ones that's Oklahoma, then it doesn't work in our state for some reason. So for some people, it might be easier for them if they call us at that 405-521-6628 phone number. So, okay.
It's a good reminder. And we do not have any questions, so I think we're good.
Okay, guys, thank you so much for joining us today. I really, really appreciate it. I hope everybody has a great week and stays out of the heat. And I look forward to talking to you again next month. Have a good day.